An intestinal obstruction means that something is blocking your intestine. So this happens in the way that food and stool are not able to move freely. So when your intestine works normally, the digested food moves from your stomach to your rectum. So along the way, your body breaks food down into usable parts and turns the rest to stool. Then you eventually eliminate it through bowel movement. So an intestinal obstruction may partially or completely block this natural process. A complete blockage is an emergency and needs medical attention right away. So today we are talking about some of the possible causes of an intestinal obstruction. Number one, abdominal adhesion. So these are growths of tissue in bands that may force your intestine out of place. Number two, hernia. So a hernia is a split in the muscle wall of your abdomen. So hernias may cause bulges and pockets which may block your intestines. Number three, volvulus. So a volvulus happens when part of your intestine twists around itself. So that creates blockage. Number four, intussusception. So this condition means when a segment of your intestine slides into another segment. Number five, scarring. So when your body heals from small cuts or wounds, scar tissue forms. So this can also happen in your intestine. So these scars can build up and create partial or total intestinal blockages. So scarring can result from tears in your intestinal wall, belly or pelvic surgery, or infections. Number six, inflammatory bowel disease. So this includes Crohn's disease and ulcerative colitis. Number seven, diverticulitis. So these are tiny pouches that can grow off the large intestine lining. So these may become inflamed. Number eight, tumors. So these are growths that may be malignant or benign. Either way, they can block your intestine completely or partially. Number nine, foreign objects. So non-food objects that can be swallowed on purpose or accidentally may cause partial or complete intestinal obstruction. Symptoms of intestinal obstruction. Number one, severe pain in your belly. So this occurs when intestines try to push contents past the blockage, by that causing intense contractions. Number two, severe cramping sensation in your belly. So this happens when the intestines keep contracting to push contents past the blockage. Number three, throwing up. So vomiting in intestinal obstruction happens because food, fluids, and digestive juices cannot pass through the blocked intestines. Number four, feeling of fullness or swelling in your belly. So this happens because food, gas, and fluids cannot move past the blockages. Number five, loud sounds from your belly. So these sounds happen because the intestines try to push contents past the blockages. Number six, constipation. So this happens because the blockage prevents stool from moving through the intestines. So under which circumstances you may be at a risk of intestinal obstruction. Number one, abdominal surgery. So this can increase the risk for scar tissue or growths. Surgeries also increase the risk of hernias. Number two, diverticulosis. So this condition means that something irritates the lining of the intestines. So we can also talk about cancer, inflammatory bowel disease, swallowed foreign objects, and chronic constipation. So in most cases, you have to go to hospital so that they can confirm intestinal obstruction. So this is done through abdominal x-rays, barium contrast studies, CT scans, MRI. So today we're going to talk about the treatment of intestinal obstruction. Number one, for a simple blockage, you may need to have only fluids and no solids to eat. So here your health provider will work to fix any metabolic problems. You may also have an intestinal decompression. Number two, you may need surgery right away if your intestinal obstruction is complicated. So this could be from a tear or perforation or a problem with your blood flow. So you may also need surgery if the other treatment does not remove the blockage. Number three, your healthcare provider may also recommend using a small flexible tube to keep your intestine open instead of more invasive surgeries. So complication of intestinal obstruction includes pain, constipation, loss of appetite, inability to keep food, fever, infections, and perforation of the intestine. So you should rush to hospital for proper diagnosis and treatment if you detect any sign of intestinal obstruction. So thank you very much. I'm Mujib. Please follow, like, and share my video.